Okay, so assessment for TFL. Now we're going to use the Ober's test, but I've got a little bit of a change on the Ober's test here that I like to modify. So I think this will be really well worth you experiments, because you need to get a bit of an idea of what sort of range of movement you've got with your TFL. So first part is that we're going to push the table leg up into flexion as much as we can. We want it up and out of the way. The leg that we're obviously looking at doing the post-isometric contractions, we have to make sure that our client has his hip in line with his shoulder and the knee in line with his hip and the ankle at the same height as the hip knee. Okay, simple as like so. Okay, and then we can get a bit of an idea of how much range of movement we have on this TFL. Okay, so obviously if he was really quite loose through here, you'd almost see the knee dropping down towards the table like so. So you're going to run an imaginary line across here, and that sort of gives you what sort of range of movement you're looking at. Okay, so Luke is actually really quite tight here, so this will be a perfect technique to do. Okay, so if they're dropping right down to the table, then there's a fair chance they have a great range of movement. Okay, so just recapping: hip, knee and ankle all need to be in the same height, and the knee needs to be in line with the hip. Okay, that's the Ober's test when we're testing for TFL muscle energy techniques. Okay, muscle energy techniques for our friend Tensor Fasciae Latae, or TFL, okay, which is this little pocket of a muscle on the outside of our hip. Okay, it's an internal rotator with our glute medius, obviously the trigger points in the upper part. An amazing muscle to do muscle energy techniques on. Okay, however, it can be a little bit tricky, so this is how we're going to do it. We're stretching obviously the right side of Luke here today on the TFL. So what we're going to do is bring the left over. Okay, so it's going to come just above his knee. Okay, and then basically what we do from here, we're going to hold this knee here such that it stabilises this side of the body, and then we just gently pick up this leg here, and then we're going to draw the leg into adduction until we start to feel that bind, okay, which is roughly around about here for Luke. Okay, so I'm going to come a little bit out of that bind. Okay, now if they start to feel it somewhere else, then you may need to change the direction of the hip. Okay, so it's really important that you're getting and you're targeting that TFL. Okay, there is no doubt that you will probably pick up a lot of the fascia, potentially of the glutes as well, because this is obviously a big roundabout of fascia, all right, but it's the TFL that we're targeting here today. Okay, so find the point of bind, roughly around about here for Luke, as I said. So we'll come a little bit back out of that bind. As I said, I like to work into the bind. All right, so we come in, a little bit out, okay, and then obviously we're going to get Luke to just gently push into abduction, or into my hand. Okay, that's enough, mate. Yep, perfect. So if you're having trouble trying to resist this and you're shaking, then that's obviously too much. So it should be a very minor contraction, 10 to 20%, okay, holding it for 10 to 12 seconds, we should all know that, and relax, 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 very good, and then taking up to the next point of bind. Okay, so now we're into that point there. Going to hold this for another 10 seconds just to simulate. And once again, relax, relax, make sure they're fully relaxed. Okay, that's good. Bring it a little bit further into abduction, so a little bit more on that. You're getting a stretch on that TFL there now, Luke? Yep, I can feel that. And contract again. A little bit less, that's it, perfect, yep. There will be a tendency for your clients wanting to push out a little bit more, okay, with this one. Okay, so it's really important that you control this contraction. Really important. Really great stretch this for cyclists and obviously our runners, okay, and relax. And just a little bit more. So I normally get about 4 contractions for TFL, depending on the client and the athlete. So once again, contract again. You've got a lot of room to play with when you do TFL, okay? And once again, always check in with your client, make sure it's not over too much. Once again, if they're, and relax, mate, relax. If they're starting to contract in the opposing muscle, you know you've gone too far, okay? And then hold the last contraction 25 to 30 seconds, okay? and it doesn't need to be on full tilt stretch either. So if it is, then obviously you need to back it off just a bit. So you need to learn to play with that bind area, okay? Once again, okay, so that's TFL, muscle energy techniques.